Welcome to Epworth in Action. I'm your host, Reverend Steve Taylor. I'm the associate pastor here at Epworth United Methodist Church, and we are so glad that you've joined us for this initial broadcast webcast of Epworth in Action, a program that really just talks about our faith in action. And on today's program, we've got some special things going on. We're going to be having a roundtable discussion. Dr. Bruce Storms from Grady Memorial Hospital, as well as a couple of health professionals from Grady, will be talking about COVID-19, something that's on our hearts and our minds right now. And they're going to be talking about that, things we should be doing health-wise, and also Grady Memorial's response to the COVID-19 outbreak that we have going on currently. Then a little bit later on in the program, Reverend Scott Kennedy is going to be bringing us some encouraging words as we close out our webcasts and broadcasts today. So we want to thank you for joining us for Epworth in Action. We want you to sit back and just kind of soak in and see how you can place yourself and your faith in action. So let's get today's program started today, and let's first off go to Dr. Storms and let's talk about COVID-19. Bruce?
Hello, I'm Dr. Bruce Storms. I'm Chief of Staff of the hospital at Grady Memorial Hospital and the former director of the emergency room for about 40 years. We're here to talk about COVID-19 and the crisis that's going on in our community and across our nation. I have with me today Dr. Mitch Coppage, one of our family practice docs, and Brad Warden, our infectious disease nurse. And they're going to talk a little bit about what's going on at the hospital and at the clinic and kind of some safety things that the general public can practice to help prevent the spread of this disease. Brad, you want to start out?
Yeah, absolutely. So, one of the things that we've been working on over the last, really, this is not something new to us to prepare for disaster. We had, other things that we've prepared for in the past. So we've had supplies. The problem that we've dealt with here is really just kind of renewing our supplies, having the continued PPE coming in. We've had a lack of testing, which has created a problem with being able to know actually who's positive and who's not. And what this has done is basically, if we don't know that you're negative or positive, we have to just assume the worst. So that has created a problem where we basically have to, treat everybody like they're positive, and everybody has to wear PPE when going into these rooms. So one of the things that we've had to do is we've kind of had to get a little bit creative with how we're going to continue to protect our staff. Obviously, that's one of the most important things that I oversee, is making sure that our staff have the personal protective equipment that they need to take care of their patients. So, it's one of those things that we look at. We have projected days of PPE, and we look at that on a daily count to see how much that we have and basically what we can get. So one of the things is that our N95 mask were the first thing that really to have a shortage on, and we needed to really figure out what we were going to do with our N95 mask if we ran out. So an N95 mask, this is a typical N95 mask here. This is really for medical people that are taking care of that positive COVID-19 patient. We do high-risk procedures in a hospital setting. We might be doing nebulizer treatments on patients. Those virus particles can be lifted into the air, and so the healthcare people need to wear this type of protection N95 mask when they're doing those procedures. So as our supply became a little bit shorter and shorter, what we did is I worked with administration and looked at ways of probably reprocessing the masks that we had. Instead of just using them and throwing them away like we normally do, we need to have a way to reprocess these masks. So what we did is we bought an ultraviolet light robot. So what it does is it uses UV light to basically disinfect surfaces. It's not something that we normally use on a mask to disinfect, but it's one of those things that we had to look into. We saw other facilities that were doing it as well. I did kind of a little bit of my own research to kind of check the efficacy. Is it really working? Is it disinfecting these masks? Because these masks they're basically 4 layers of material. So I did my own little research. I basically, took a little bit of E. coli, so it's a pretty hardy bacteria that grows pretty fast, put it on the inside layer of the mask, and check the processing of the UV light. What kind of contact time do we need this mask to be exposed to UV light? How long does it take to kill that bacteria on the inside? Because we realize that, it'll kill it on the outside, but I want to make sure that, we're getting a good kill on the inside as well. So we got that process kind of figured out, and we're having different receptacles throughout the facility. So people that are using these N95 masks, they basically use them for 8 hours. They put them in the receptacle for a one-time UV irradiation treatment. We repackage them, and then we get them back to the people. And they put their name on it so we can get the mask back to them. So that was one of the first things that we dealt with, was that. So we pretty much I feel that we have a pretty good count on our PPE. Doing that basically doubles our supply of masks. Our next problem was our gowns. So we have protective gowns. Usually we put them on, we go into a patient room, we come out, we dispose of it at that time. But like I said, we're using more PPE because we don't know if these patients have COVID-19 or not, and so we're using more of this product as well. And our supplies were coming up a little bit short. So we reached out to the community, and we bought the material like ripstop fabrics and different fabrics that are kind of waterproof, washable. And so we have some great seamstresses in the community that are sewing these gowns for us. And that if and when we run out of this product, we'll be able to use this product and basically launder them after use. So that's one of the things that we've done there. We've got, we should have maybe, between 50 and 100 over the next week or so of that product to help us with any issues that we may have with our disposable gowns. Gloves, we're doing well. We have goggles. We've had a lot of people in the community help us out with gloves and goggles and different things, hand sanitizers, wipes. Definitely appreciate all the help out there, because a lot of these products are really hard to get a hold of now, as many of you all know. And so, and we've definitely been using a lot of these products in the facility. So one of the things I like to talk to the public to a little bit before I pass this along is, the cotton masks. I call this a Love Thy Neighbor mask. We're wearing this to protect our neighbor. We're not necessarily wearing this to protect ourselves, but the studies show that one layer of cotton, like a T-shirt, can actually filter out about 50% of expectorated material. It also decreases the velocity of any expectorated drops, and so they won't go far. And this is a great prevention system that we can wear out there when we're out there in the community. So we're for, like Walmart, we go to the wherever we're at in the community, this is a great item to wear. So I just want you guys to be kind of familiar with a different kind of mask that you may see out there. This is like a surgical mask. This is a NIOSH rated mask. So we have rated masks for different things that we do. Some of these come with a shield, some of them don't. Many of y'all can wear these in the community too. They're easy to breathe through. They're just very hard to get. This may be our best option as a community is to wear these. But we need to wear them. We don't want to have just a few people wearing them and a lot of people not. We need to really come together and do this as a community. And I think that'd be a good practice. So.
Hey, Mitch, you want to tell us a little bit about what's going on at Five Oaks and taking care of our patients? Because we've still got to continue to take care of all the sick people, not just the COVID-19 people. And we still have sore throats and earaches and sprained ankles and those sorts of things that we need to be following. If you'll tell us a little bit about what we're doing over at Five Oaks.
Sure. I've been a family practice doctor here in Chickasha for almost 25 years. Am certainly not an expert in infectious disease, so we lean heavily on the specialists for those opinions and recommendations. At Five Oaks, we've got several different levels of care. The pediatricians jumped on board with this problem pretty early. They've been doing telemedicine visits. They have divided their clinics in half. They see the well children in the morning, and the well visits are really only the necessary ones, kiddos that are in need of vaccinations. They decided early on they didn't want to survive COVID and then turn around and have a measles outbreak in 6 months. So they've been very forward thinking in that area. In the afternoons, the pediatricians see their sick children. Anybody that comes into Five Oaks, we narrowed down to one main entrance. Everybody is screened there. We do check temperature. We have masks available. I think most everybody that comes in now gets some form of a mask. Hand sanitizers are there. And then the patients are either directed up to pediatrics or to one of the primary care sites. Primary care for our chronic patients, both new and established, we've really converted over almost completely to what we call telemedicine. Those are either telephone visits or, as often as possible, video visits. We have a great IT department that's put this together for us. That way we can take care of the chronic folks without them coming in, being at risk of getting out in public. For acute problems, our express care is still open. We have moved them downstairs so that patients don't have to move through the hospital or the clinic to get there. Mary Ross and the other nurse practitioners and PAs are still working that system. Some of the primary providers, the other doctors in my group, are still seeing patients as well. We try to screen very carefully patients that are acutely ill with respiratory problems. We encourage to stay in their car, and a provider will come see them there or send them home and immediately follow up with a telephone call or a video visit. As far as the community, most of us have heard these guidelines before, but they're very, very important. We in Chickasha have been very lucky, very blessed in that we have not had a positive coronavirus test result come back.
That's at the hospital or clinic.
Right, in the clinic. And nursing homes. I mean, we've sent out several tests, but we haven't tested very many. That's starting to ramp up. At the fairgrounds today, we had over 80 patients tested, so we're looking at 100 plus tests that we've done now. So I think our results in the next few days might be different. That will guide some of the decisions we make. But it's still very important for everyone to stay at home. You hear that nationally, it's the same locally. That's the one certain way that we can prevent the spread of this virus. If you do have to get out, as Brad said, you can wear a mask. That will protect our fellow citizens. Hand sanitizing, safe distancing, these are critical steps, and they've been pounded into our heads nonstop for several weeks. I feel like in Chickasha, we're rural, but some of those steps are working. It's preventing the spread. It's keeping our numbers down. So I think we should all continue to listen to those recommendations and abide by them as much as possible.
Okay, I'm going to have a couple of follow-ups. Right now, there is limited access to the hospital for those coming. We're limiting visitors to an inpatient right now. They can have one family member with them. Doctor visits, unless you need an assistance of your child, a parent can go if it's an elderly patient that needs someone there to help them, then they can go with them. But all those people are being masked. The three entrances to the hospital are the front door of the hospital, where if you're needing lab or x-ray, we've moved a lab draw area down to the lobby. You're brought in, you're screened, and you go either directly into x-ray or over to get your blood drawn and then back out. If you're coming for a doctor visit at Five Oaks, it's the front door of Five Oaks. Again, you're screened at that door. And the third entrance to the hospital is the emergency room. We're encouraging people to still come to the emergency room for those emergencies. We don't want you staying home with chest pain. But we are screening to try and treat as much respiratory illness as we can outside the facility with either a telemedicine visit or a curbside visit. For future settings, we are set up to do some drive-through in the parking lot on the west side of the emergency room. There'll be new signage for that. There's a driveway being cut so you can circle through. And the first floor west wing of our hospital is set up to take care of the COVID-19 patients should that start to occur. So far, there have been no positives at Grady Memorial Hospital. There have been some positives in the county, but they were tested either in Norman or Oklahoma City and were not tested at our facility. We think as we start doing more tests, we will start finding more people that are positive, but we just hope to keep the spread to a minimum. As you can see, we're sitting 6 feet apart here, and we carry masks to wear when we're out, and we wash our hands frequently. I want to encourage the public to cover your cough with either a handkerchief, your arm, or wearing a mask. Wash your hands frequently and stay home and stay away from other people. The social distancing is important. Now, we know that there are some times you might have to get out to get food or that sort of thing. Just take appropriate precautions. And if there are questions, you can call your provider at the clinic, and they will get back with you to help answer questions. I want to thank everyone for being here today, and we wish everyone in our community a blessed and safe future.
Thank you, Dr. Storms. Thank you, Dr. Coppage and Brad. We thank you all for being here, and thank you for keeping us educated. And thank you for Grady for everything you're doing to help keep us healthy as well during this COVID-19 outbreak. Now, time for some encouraging words with Reverend Scott Kennedy.
In Luke chapter 5, there's a story about Jesus teaching in a home. And there were lots of people who came to be a part of the event. They wanted to hear what Jesus had to say. So the house was full, the doorway was full. There were people standing outside the doorway watching and looking just to hear what Jesus had to say. There also was a group of people who came, a group of men who were bringing a friend of theirs, a man who had been paralyzed. And they brought him because they thought Jesus might be able to reach out to him in some way. They couldn't get him into the building. They tried to come through the doorway. They couldn't get to the door. One of them had the idea. They climbed up on top of the roof. They opened up the roof, and they lowered their friend down to where he came into the room right in front of Jesus. In the story, it tells us that Jesus and he had a conversation. They spoke. He spoke with the people who were there. And then he told him to get up and to take his bed and to go home. And here a man who had never been able to walk before was able to get up, and he took his bed and he left. In this story, there are a couple things that I think of, particularly during this time. First is that God cares about our health, and God cares about our wholeness. God wants us to be well. God wants us to prosper in life, to be whole, and he seeks our healing. And Jesus sees this very real need and reaches out and brings healing to his life. The second thing is something I think maybe we overlook often, and that is that his friends bring him. The friends of the man who had been paralyzed bring him to Jesus. And here in that community that he was a part of, it was his friends who sought his health and his wholeness and brought that need before Christ. I think there's a lesson for us today as we are in the midst of this COVID epidemic that's around us, that we need to be looking out for each other. It's about caring and wholeness and community, and how God uses us to bring about healing in each other's lives. Part of that can be by just checking up on each other, looking out for one another's spiritual needs, physical needs. You might check up on a neighbor who it would be unfortunate for them to have to get out to get something. If you can go and help meet that need for them, that would be an awesome thing to do. We need to be looking out for each other. Our health is a matter of health for the community. Also, as our doctors and the staff from the hospital who were visiting with us earlier that let us know, they are seeking our health and our wellness, and they're a part of God's healing for this community. And we give thanks for the work that they do, and all the healthcare workers, both here in Chickasha and across the country. But the other piece is that one way that we can tend to one another's health and be good neighbors is for us to be able to practice social distancing. That even in that way, we are putting the needs of others ahead of what we might think of as the needs of ourselves. We are seeking to find that health for each other. So we want to just share this word to you. Know that God is there for you. God's seeking your healing and your health, and God needs your help as a partner to bring about healing in the life of the community. Thanks, and we'll see you next week.
Thank you, Pastor Scott, and we appreciate your great words of encouragement there. We'd like to thank you guys for joining us today for Epworth in Action. Don't forget, we're going to be here weekly. We will premiere on Wednesdays at 7 o'clock. and then it'll run throughout the week on Channel 6 on Suddenlink, and then also will be available on our YouTube channel at youtube.com/chickashaumc. Thanks again for joining us for Epworth in Action.